Let's tackle this NCLEX prioritization question of the day. So the nurse is coming onto shift and is assigned 4 clients. Which of the following should the nurse see first? Now when you tackle these questions, I want you to look at a diagnosis and I want you to ask yourself, is this person stable or unstable? Now I want you to pause the screen and give this your best try. Let me know your answer in the comments. If you don't want to pause the screen, then let's run through the rationales together. So option A, a 35-year-old male who had a valvuloplasty 2 days ago and has a new unilateral swollen leg. Whenever I see unilateral swollen leg on NCLEX, I'm immediately thinking of a DVT. If it's bilateral, symmetric, then you're not really thinking of a DVT, but in these situations, those are your keyword red flags. So I'm leaving option A open because it's a post-op patient with a DVT. Option B, a 70-year-old male with a history of COPD who states to have a chronic cough and a new production of yellow sputum. So COPD is chronic. It says it in the name, chronic obstructive pulmonary disorder. I am going to expect that this patient would have a cough, and if they're presenting with a new production of yellow sputum, then I'm thinking that they're having an infection, like an upper respiratory infection. However, this patient isn't in acute distress. They're not unstable, so this is not my priority. Option C, a 15-year-old female with painful cyanotic extremities after holding a cold glass of water. Now, there's a disease that is associated with vasoconstriction of the extremities when exposed to cold, okay? And this disease is Raynaud's. I can anticipate that this patient is just having a regular symptom of their disease, so I'm going to cross out option C. So now I'm left with option A, which is the DVT, and option D, which is a 50-year-old female 12 hours post-open heart surgery who states she is having tearing-like pain in her abdomen. There is a keyword red flag in this sentence, and that keyword is tearing. When you hear the word tearing in the abdomen is specifically after surgery, you're immediately thinking of a dissection, an aortic dissection, okay? This is going to trump option A because option D, that patient will bleed out into their abdomen and they are more unstable and critical than somebody who just has a DVT present. There is no sign that that DVT has dislodged and turned into a PE or a stroke. I hope you learned something from this question. Prioritization is a very challenging topic to master on the NCLEX. They do not make it easy, but always ask yourself, who is stable, who is unstable, what can I expect with a person with this diagnosis, and what can I not expect? What are my red flag words, okay? Follow for more videos and NCLEX questions of the day.